Hello, I'm Matthew Upton, Chief Medical Officer for Thomas Health. Thank you for choosing Thomas Health for your healthcare need. The physicians, nurses, and staff would like to welcome you to our Joint Connection facility. This video is the first of an educational series to help prepare you for your journey during your joint replacement. Let's get started.
Hi, my name is Lisa Holstein, and I'm a nurse in the pre-admission testing department at Thomas Memorial Hospital. Here are a few things you can expect. You will receive a phone call approximately 2 to 3 weeks before the date of your surgery from a nurse in our department. Please be prepared to answer questions regarding your medical history and have a list of your medications available. You will be scheduled to come in for a clinic visit approximately 2 weeks before the date of your surgery. During this visit, lab work and other diagnostic testing will be performed. You will meet with one of our mid-level providers who will ask questions and gather information necessary for your surgery. You will receive instructions on medications that you may take the morning of surgery. And you will receive instructions on bathing with an antibacterial soap the night before and the morning of surgery. This soap helps to remove germs from your skin and will lessen the risk of developing an infection.
Hello, my name is Cheryl Hull, and I'm a physical therapist at Thomas Memorial Hospital. I am proud to be a part of our outstanding Joint Connection team. Prior to your surgery, you need to make some preparations. First, please refer to thomashealth.org for a video demonstration on physical therapy exercises that you need to be performing prior to your joint replacement surgery. The purpose of performing the exercises is to strengthen the muscles in your operative limb prior to surgery. This is extremely important for your recovery. Next, you need a plan in place for discharge. Who will be with you at home to assist you? Who will drive you to your appointments? If you have any concerns about your discharge plan, you need to call your surgeon prior to surgery. Now let's talk about preparing your home. Look for tripping hazards, cords, etc. Pick up throw rugs. Make sure your lighting is good. Clear pathways. If you are having a hip or knee replacement, make sure you have open pathways to allow use of a walker in the home. If you are having a shoulder replacement, prepare for that arm to be immobilized in a sling. Pick out loose clothing to wear after your surgery and store frequently used items within convenient reach. If you are having a total knee replacement, you will be required to continue your therapy as an outpatient. We recommend you make your first appointment prior to surgery. You need that appointment to be 3 to 4 days after your surgery date. For your convenience, Thomas Health has outpatient physical therapy departments at both Thomas Memorial Hospital and St. Francis Hospital. If you choose one of our facilities, we would be honored to assist you in your continuing journey toward full recovery.
My name is Pam Buckner, and I am the resource nurse for the Joint Connection. Prior to surgery, you need to stay as healthy as possible. It is very important to avoid community exposure to viruses or infection and to have good nutrition. We recommend foods high in fiber, high in protein, and drinking plenty of fluids before and after surgery.
If you have a living will or medical power of attorney, please bring a copy of this document with you to the hospital on the day of surgery. You need to bring clothing and items such as t-shirts, shorts, shoes with rubber soles, and toiletries. If you use a CPAP machine at home, it is very important that you bring this with you to the hospital. You will need help at home after discharge, so please make arrangements for this.
Plan to stay in the hospital 1 to 2 nights. Do not eat, drink, chew gum, or use tobacco products of any kind after midnight on the day of your surgery. You may take medications as directed by your surgeon or anesthesia with a sip of water the morning of surgery. Please designate a coach to be available during your stay and at home. They will be educated regarding your post-op care and home exercise program to assist you as needed.
Hello, my name is Amy Black, and I am a nurse in the surgery center at Thomas Memorial Hospital. On the day of your surgery, you will report to the surgery center. One of our patient safety initiatives is to ensure that we are providing care for the correct patient. The two patient identifiers that we use at Thomas Health are the patient's name and the date of birth. You will be asked your name and your date of birth during your hospitalization on numerous occasions to maximize your safety. You will be taken to the surgery center where a nurse will get you ready for your surgery. You will speak with the anesthesia team. You will have an IV started and you may receive medications that are ordered by your surgeon or the anesthesiologist. Your surgeon will visit with you before surgery. When it is time for your surgery, the operative team will take you to the surgery room. Following surgery, you will be taken to the recovery room, where a nurse will monitor and care for you until you are ready to go to your room on the joint connection. You will have a dressing and ice applied to your surgical incision. Depending on the time that you are scheduled for surgery, it could take approximately 3 to 4 hours for you to be moved to your room.
When you arrive on the joint connection after surgery, there are two main goals that we will focus on: mobility and pain control. Your nurse will provide instructions on what medication your surgeon has ordered for pain. You will be asked questions about your pain at regular intervals during your hospitalization to ensure that your pain is at a level that is tolerable for you. At times, patients will experience nausea or itching following surgery, which is caused by anesthesia. If you have nausea or itching, please let your nurse know. Early mobility is extremely important to prevent complications after surgery. A physical therapist will get you up in a chair shortly after arrival to the unit. You will remain up until bedtime. Your nurse will encourage you to cough and deep breathe and use a device called an incentive barometer to assist with prevention of complications after anesthesia or surgery. Your surgeon will order medication to thin your blood and compression stockings or a device that will be applied to your legs or feet to assist with blood control. This is to assist with the prevention of blood clots.
On the morning following surgery, the staff will assist you with taking a bath and getting you up in a chair before breakfast. If your surgeon has ordered blood work, someone will be in to collect your blood as well. Our two main goals will be mobility and pain control.
The morning after surgery, you will have your most extensive physical therapy session, and many of you will go home after this session. You will be up and moving, and we will continue to help you walk with the use of a wheeled walker or cane, along with stair training. Equipment as needed will be delivered directly to your room prior to discharge. You will have your first exercise session and you will be thoroughly instructed and also perform all the exercises that will be part of your home program. Your program will be a little different if you've had a shoulder replacement. We will want to make sure you are able to mobilize safely, know how to correctly position your sling, know how to protect your new shoulder, and provide instruction about any home exercises your surgeon has ordered. Most patients are discharged home the day after surgery if they have met their physical therapy goals and are medically able. Every member of the team is focused on educating and preparing you for a smooth transition from hospital to home.
My name is Leslie Boyer, and I am a social worker at Thomas Memorial Hospital. A member of our care management team will work with you to determine what your discharge needs are. If you require any equipment or supplies, we will work to ensure that you have them before you are discharged to home. It is our goal to ensure a smooth transition at discharge.
On the day of discharge, you will receive discharge instructions that are individualized to meet your needs. You will receive instructions on medications that your surgeon has ordered for you to take at home, to include home medications and any newly prescribed medications such as pain medication and a blood thinner.
We have a service available at Thomas Memorial called Meds to Beds. If you would like, our outpatient pharmacy can fill any newly prescribed medications by your surgeon. These will be delivered to your room before discharge. You will receive detailed instructions on activity, outpatient physical therapy, follow-up appointments, and how to care for your dressing and incision at home. Remember to eat foods high in protein to promote healing and foods high in fiber to assist with regular bowel movement. You may need to take a stool softener to avoid constipation that can occur as a result of decreased mobility, pain medications, or anesthesia. Avoid sitting for long periods of time. You need to move and perform your exercises as instructed. If you have any questions or issues, please call your surgeon's office. Thomas Health would like to thank you for choosing Thomas Memorial Hospital and the Orthopedic Center of Excellence. We hope this video has been helpful in getting you ready for surgery.
For more information, please call me, Pam Buckner, Resource Nurse, at 304-766-5444.